So far, no attendees, just me and you. I'll start putting people in a second. Jean Edwards, Karen. Karen Logue, is she one of our presenters? Karen Logue? No.
No.
Kelly Long. Hey, Kelly, I see you on the call. Thanks for joining us. Hey, Heidi. Bill, hey, Bill. Welcome aboard. Hey, Beth. Beth Paul's here. Sarah. Got Susan Doyle. Hey, Jeannie. Good to see you. You're on mute still, Jeannie. There's Bill. Hey, Bill. I can hear you now, Bill. How's it going? Hey, Dick Halverson's on the line. Hey, thanks.
Yes.
Dick. Janice, I see you there. Great. Hey, Lori. We're going to wait a few more minutes, folks, until we have the rest of our panelists all on the call. Thanks for the note, Susan. She says hello to everybody and hopes we're all staying well.
Hey, Bill.
Janice. Hello, Janice.
Hello. Hello, hello.
Good
Hi,
to
Janice.
Hi, how are you?
Good.
Good.
Let me know when you start streaming too, Ben.
Okay.
No.
We're streaming to Facebook Live. It's like we're just waiting.
Maybe we got to talk to people?
Yeah.
Wait, what?
Is that gonna be a problem, Bill?
Did you tell me that?
Yeah, you're a little shy, Bill, so, you know.
I missed the memo.
Looks like we're waiting for Linda Milton, Megan Hope. And if you're on the call, Linda or Megan, but you are under someone else's name, please be sure to raise your hand or chat so I know who you are. Because right now I don't see your names.
How many RSVPs did you get, Christina?
Well, there was a bunch on Facebook, and then Ben got some, and then I guess some people are just going to be tuning into the live stream. Ben got like 50, and there was like 40. What is Heidi saying?
You can't activate her video.
Okay. Is Heidi a panelist or just a participant?
They can. Heidi Marshall is not a panelist.
Okay, okay.
She's just
Hey,
a
Heidi.
very important person.
Oh, I see the attendees. Okay.
Heidi, go ahead and you can either hang up, Heidi, or if you can see us, you're good. If you can't see us, then you want to hang up and call right back in.
Oh, she says she can see.
Good to see you, John. Okay, Ken's on the line. Great to see you, Ken. And Jennifer, great. Should we text Debbie? I don't see Debbie on the line yet. We got to get Debbie on the call.
Debbie who?
Debbie Freeze.
I know.
Oh.
My middle initial S stands for sarcasm.
Kelly, we can just see there'll be 6 panelists on the video today.
Yeah. The Loving Them Forward supermodel. Debbie Freeze.
Well, she'll get a swelled head. Don't.
She's the most humble person in the world.
She is.
Joining us now. Great. All right.
So,
Linda.
Jody says it's not letting me in. Here, hold on one sec.
Debbie says it's not letting her in. Hey, Megan. Good to see you.
Hey, Megan.
How are you all?
Stage fright, but a little bit's good, right?
A little bit's good. I like to head nod.
Jody Z, she needs the link for the Kelch again. It's not letting her in. It kind of didn't send her the link.
Jody or Linda Milton?
Jody's Zelensky
To get into the
webinar.
Okay.
She says there's a password that's not working.
Right. Let me pull that password up for you. Okay. You tell her. I'm going to put this in the chat, right?
Yeah.
Chat. Can you,
Benjamin, you could be more than the generic Kelch communities.
Christina, can you see that password that just showed up in chat?
Nope. Hey, Megan.
Hey, Christina. Did you not see me before?
No.
Oh,
Snuck in.
I snuck in.
Okay, where's my? Chat.
Oh,
Hello from Connecticut. Awesome.
Oh, yay.
My home state.
Whoop, whoop.
give me just a second. Debbie's having some problems getting on. Give me one moment. Thanks for your patience, everyone. We have about 25 more people we're waiting for.
Oh, Elizabeth is on.
Right.
Elizabeth Lee Bradley, the one and only.
Oh, Elizabeth Lazon. Oh my gosh. What's
Yeah,
going
I know. We love her. She was our keynote speaker at the Caring for the Caregiver event, and she was a speaker yesterday for the Kelch event.
on? Good.
Nice.
Good. All right. So let's see if our community home health partners have joined us yet. I'm looking for Linda.
Nope, doesn't work. Okay.
Oh, it's okay. Who's emailed it away? I sent it to Linda Melton the first time. So do I need to send it to Jody instead?
Yeah, Jody. Yeah, because they're trying to use it when I type it, and you know how well my eyes work.
So I'm gonna send it to Jody Zelazny here. Okay. You tell her that she just received a brand new invitation in her email at CHH. Christina?
Yep, I'm texting it right now.
Hey, there's Debbie. Hey, Debbie, good to see you on the call. Wonderful.
Hi.
Right, we've got one more person and we're ready to go.
Megan's on.
Megan's on, Janice on, Jeannie's on, Bill's on. Linda's the one we're waiting for. Okay.
It's on.
Yeah, she was having trouble.
Okay, well, I'm sure that, oh, there we go. I see Linda. All right, Linda's on. Yay. Okay, we are ready to go.
Okay, everyone looks beautiful and handsome.
Flattery will get you somewhere.
Yep.
I actually took a shower today.
Yay!
No comment.
Awesome.
Doesn't matter.
All right, so Benjamin, are you going to then push this out to the public?
Yep, as soon as I see Linda. All right, there's Linda. Okay, now I'm gonna go ahead and push it out.
Hi, Linda. Let's get
There you
going.
go.
Thanks everyone for being here.
All right.
So we have about 40 participants that registered, so.
Wonderful.
Sweet.
Okay, well, let's get started. So welcome everybody to our Loving Them Forward event today. We have quite an agenda. You know, Christina had the idea. She said, you know what, there are so many caregivers, family caregivers, who are all of a sudden, all the resources they've been used to for helping them are dried up, or they're gone, or they don't know where to find them. Everything's changed, and the media information, everything's hard to understand. So she said, let's get together and let's figure out in different areas of our community and different kinds of needs, what's really available, what's really going on. So she assembled a group of several different experts in our community who each said, all right, I'll take an area, I'll take groceries, or I'll take pharmacy, and I'll talk through that. I'll think about what's there. I'll make the phone calls and I'll put them into a short, about 5-minute presentation. So what we're gonna see today is several different folks sharing about what they've learned. So before I go any further, however, I've been asked to read the Loving Them Forward mission statement. So give me 1 second while I share the screen for that. 1 second here. Okay. Okay, there we go. Very good. All right, so Loving Them Forward is a community of people that have been taking care of family members and seniors through life transitions, personally and professionally. We're committed to improving the well-being of caregivers in our community for providing free support, education, and resources while they care for seniors and loved ones. Family caregivers and seniors don't have to do it alone. So again, the purpose of today is to look at what resources are currently available during the COVID-19 challenges for family caregivers, as well as professional caregivers who may be taking care of clients at home. Somebody needs to mute the phone. Mute the phone, everybody, real quick. All right, there we go. Christina Keys is the Loving Them Forward co-founder and president. She does have a message for us today. So Christina, please share with us what you wanted to share.
All right, thank you, Benjamin. Well, as Ben said, my name's Christina Keys, and I'm one of the co-founders and the president of Loving Them Forward. I'm also a caregiver for my mother. I've been caring for her for almost 8 years. And some of the challenges myself and other caregivers have been facing during the COVID experience is we've had a really difficult time finding the resources we need. And also it's just been incredibly stressful and heartbreaking through all of this, being a caregiver by the side of our loved ones. It's been hard to find the resources, not only because everything's changing with the stay-at-home order, but also because a lot of businesses are doing things different. And so what we wanted to do today was, based on the calls we've been getting from the Loving Them Forward hotline for the resources that are needed, because they're very different than what the calls that we typically get. So based on those calls, the needs of the caregivers in the community, we put together a panel of experts, and they're going to be going over today things like, you know, where and how to get food, what transportation options are there for rides and pickup and delivery, how and where to get caregiver support. I know a lot of us are used to going to support groups, but that support's still out there. Medical resources, since a lot of us are having to step up and do some medical things because we aren't able to take our loved ones to doctors as often, and also grief and end-of-life support. As a caregiver, one of the things we need you to know is that you're not alone, and we understand that this can feel like a really lonely time with much higher levels of isolation than us caregivers usually experience. But Loving Them Forward has a whole community of businesses, organizations, and individuals who are here to help you so you don't have to walk through your caregiving journey alone.
Thank you, Christina. I really appreciate that. So today, here's what this looks like. We're going to have Janice will be speaking from Meals on Wheels about food resources. Then we'll have Jeananne from the Human Services Council. She will be speaking about transportation, pickup, and drop-off resources. Bill Cohen with Cohen Caregiving Support Consultants will speak about caregiver resources. Linda Melton from Community Home Health and Hospice will be discussing medical resources. And then we'll have Megan Hope from Bridges speak about grief support and end-of-life resources. Now, they have done a lot of work to try to compile as many resources as possible. However, we know that many of you on the call are here specifically because you also have things that you know about that these folks may not have found. And so what I would love for you to do is, anytime you're hearing a presentation and you think of another resource that matches that particular topic, please go ahead and put it in the chat. You have the chat at the bottom or top of your screen. Just go ahead and type in any resources that you're not seeing presented that you might know about. And then what's going to happen afterwards is Debbie with Home Instead, she's taking all the presentations, she's going to sort through them and put them into an email that will go out to folks afterwards. Anybody who's on the Loving Them Forward email list will get this, and she'll add anything from the chat, because we'll have a transcript of the chat that will be available to Debbie afterwards. So go ahead and chat right in, and then we'll make sure that Debbie gets all the resources that any of you put down that we may not be showing today. All right, with that, let's go ahead and have Janice go ahead and speak to us about not Meals on Wheels, about food resources. Thank you.
And Meals on Wheels, yes. Thank you so much, Benjamin. Thank you for inviting me, and I hope we can get some resources out here. So obviously, I'm with Meals on Wheels people. We're in Oregon and in Southwest Washington. There's my information if you would like to find me. So the first one is actually that phone number there is our intake line. So if you're looking for someone who would like to get a meal at this point in time, that's the 503 number. That's our intake. You can certainly reach out through that number, and then our website, which has all of our resources on there. You can find out about volunteering, how to get food, anything else that you are looking for that may be pertaining to Meals on Wheels people. This is my, oh, back up there. There you go. So that is my direct line. That's my office number and my email. Feel free, if any of you have specific questions, I am always available, mainly by email. Obviously, I'm not at my desk. I'm checking messages daily, but I am absolutely happy to answer any questions, whether it involves Clark County or across the US. Please feel free to contact me. I'm happy to help. So I'm here today basically just to kind of give you an idea of where to look for food. And food is a broad term. So whether that's going to a grocery store, going to your food bank because there's some financial stressors, whether it's getting meals at home, whether it's helping others find maybe a neighbor or a friend. These are just kind of some things that in doing some research locally here in town that I found. We have an amazing food bank here in Clark County. Clark County Food Bank has been a huge resource to us, especially as of late. Look up in your state, your county, depends on how it's rated and who's actually running that particular food bank. It may be under the state you're in, it may be under the county. Here it's for Clark County Food Bank. If you're in Clark County, I highly recommend, and I'll have connection information here near the end, phone numbers and addresses you can look up. They are a huge resource. Also check out your local food share and pantries. Clark County Food Bank has probably 25 pantries they connect with all in Clark County that you could reach out to, whether it's up in Battleground, out in Washougal. There's many, many resources. Churches, Adventist churches, especially a larger one here in Clark County. Any kind of a Catholic church, there's a couple here in town as well that are doing food boxes and also doing some sort of delivery to either folks in their congregate or folks that maybe are neighbors. There's a huge outpouring right now. And then of course, Feeding America, that's just for local resources as well. If you look up Feeding America. Here on Meals on Wheels, our main goal is to deliver to seniors. As you all know, we normally have clients over 60 years of age. Right now, we're delivering to more than just those clients over 60 because the need has been so huge. With our program, we also do supplemental. Like I said, Clark County Food Bank has been instrumental in helping us get food boxes to the homeless that we're feeding right now. So we're kind of a filtering for them. We pick it up from them, we get it out to those clients. Part of our delivery system right now, because we are not doing deliveries every day like we used to, we've changed things up like everybody else has. We are down to 1 delivery a week, delivering 7 meals to that person once a week. Using the non-contact method. Because we're not seeing them once a week, we're also doing wellness checks. And so once a week, we're talking with them and saying, hey, Betty, you know, how you doing with your food? You need more, you need less, that kind of thing. We've also added what we call a friendly chat. So we have volunteers, lots and lots of volunteers who are just calling these people at home and just chatting about the weather, about Wheel of Fortune, about a book they're reading, you know, no politics, no religion, just life in general. Other programs are Store to Door. There's healthcare services. I know Home Instead was doing some things as well. And then of course your local grocery stores. Reach out to those folks if you're in the area, Fred Meyer's and Safeways, that kind of a thing. Okay, Ben. So find any kind of a Meals on Wheels program. For some of you who may not understand, so I work for Meals on Wheels people. That's our name. On Wheels is sort of like saying Kleenex to tissue, right? That's kind of a program overall. It may not be the same in every state. Some programs are run through the state and they're run through senior centers. So when you're Googling or searching for a Meals on Wheels, you can use the words Meals on Wheels, but just know that it may pull up Adventist services, or it may pull up a Catholic community center, and it may not say the words Meals on Wheels. So just don't get confused by that. It's the same program, it's just run by somebody different, but every state has some sort of program that helps the seniors and homeless in need. So again, here's the intake line for us, Meals on Wheels specifically. You can also go online. We have a form online that you can go to if you look at mowp.org and then go to, sorry, my window got something up, get meals. And then you can also search by dining centers. As you know, most of you know, all of our dining centers are closed. We're doing only home delivery. We don't even do pickups at our site right now. So everything has been moved toward home delivery. We are doing non-contact, which means that we ring a bell with a pencil or pen, we step back, we leave the meal on a chair, a table, a ledge, acknowledge that client is there, wave, say hello, and then we leave and move on to our next one. So there's no direct contact. We do have clients that have been diagnosed with COVID. Those are strictly staff deliveries and are taking extra precaution with those. Like I said, all of our congregate has been moved, if they choose to a home delivered route. We've had enormous response. We are doing 1 time a week. So we were doing 2 times a week. The first 2 weeks we were doing that, and then we moved into 1 time a week. Again, we're trying to do as little contact as possible. We still continue to do anything and everything without a wait list. Our business has increased 450% over the last 5 weeks. I can tell you personally, I've had 1 day off in about 35 days, and it's been a good thing because we've been getting the meals out. Again, over 1,800 people have signed up to volunteer, which we think is an amazing feat. Majority of them are in Clark County. Whoop, whoop. We appreciate all of those folks that are signing up and for volunteering. It's been a real struggle to try and keep them busy because we have a lot to do, but again, we're really focusing on that non-contact. And so we know that volunteers want to go out and bring meals and help out, but every person that touches that piece of food or that packaging or drives that car or comes in that center is just one more person. We've now extended that possibility of exposure. So we're trying to keep it as little as possible. So here's some basic programs here in Clark County. Like I said, the food bank is your biggest resource. If there's any kind of a financial stressor and you're looking to get some a boxed food or food to your home or to someone else, food bank is amazing. Area Agency on Aging and Disabilities, they are our partner. We work with them, they work with us. Again, another phenomenal organization. You can call this number or what they call gatekeepers. They can refer you to somebody if we can't help you out, which at this point in time we can. Independence Northwest, Oregon Food Bank, who is a partner of Clark County Food Bank, and of course Store to Door, and Multnomah County Aging and Disability Service. Because we are based in Portland, a lot of our information we have comes from Portland. And I want to note, as I stated before, our particular clientele has moved out of that over 60 range. And so if you have someone you know needs a meal, call me, let's have a conversation. It's a case-by-case basis, but we have not turned anyone away that needs what we need to be doing. We're delivering to the homeless, we're delivering to hotels that have folks with families. We've expanded our service to anybody who could possibly need a meal that we can get to. Here's other options for seniors as far as shopping hours. There's been a lot of good reception out there for stores really taking time to make sure those seniors can come out safely, or those with a weakened system. So Fred Meyer, Target, Walmart, again, Walgreens, Costco, New Seasons here, Whole Foods, and Trader Joe's. This will all be on the information that Deb can give you. But again, great resources if you're looking to be able to go out and shop for that person or a weakened immune system or a senior. This is a good time to go out and do that. Restaurants to go, there's a great website there. And of course, our diner. So a lot of you have asked about how our diner is doing. Yes, we've closed down. We're doing takeout only. I encourage anybody who can to please help support us. If you want to support any diner, any restaurant, go buy a gift certificate. Get a gift card, a gift certificate, so that when this thing does blow over, they can go out and actually use it. That's helping to sustain a lot of the restaurants. We had someone come in this morning and purchase 20 gift cards. It was amazing because that's going to help us sustain. Diner is now being used as storage for additional food and shelf stable items that we're passing out. So it's become a new hub for me to actually package meals there. So we still are there, but not as busy as we used to be. And there you go. Again, my information, I encourage you to write it down, write my phone number down, email me. I am absolutely happy to answer any questions. My book is open. If you have any specific questions for me, please feel free to do so. And I thank you for your time.
Thank you very much. Now we're going to hear from Jeananne Edwards with the Human Services Council. Jeananne, we'd love to hear from you now.
Great. So I wanted to really just thank everyone for letting us to be here and share what we have learned. I know a lot of us have been calling each other for many weeks trying to find what resources are out there. So thank you. You go ahead and change the slide there. Jeananne Edwards, I'm with the Human Services Council, which is an agency in Southwest Washington that's all about transportation. Go ahead and change the slide. So normally what we work on is transportation through many different options. We have a one call, one click resource that anyone can use. I'll have the link up here in just a little bit. It really will let you know from one place to the next what transportation options are out there. And that could be anything from Amtrak and C-Tran down to what private pay agencies are out there, what nonprofit agencies might be able to have transportation for you, many resources. I run a volunteer driver program normally, Volunteers in Motion, which is for people 65 or older or those with a disability in Clark County. We can take them anywhere. So we can do the medical transportation type things for those non-Medicaid, but we can take people to get their hair done. We can go to grocery shopping. We can go to the library, anything like that. We are the Medicaid broker for the area. So people on Medicaid call us and get their transportation booked to go to medical appointments. We have 2 employment transportation programs, including a bike to work where we can get people bicycles if that would help them get or maintain employment. And then we have a reserve a ride program, which is for people needing life-sustaining treatments such as dialysis or cancer treatment. Go ahead and change for me. But right now, we've really switched gears. We are all about trying to help people stay home and stay healthy and what we can do to get them any essentials that they need. So we are still taking people to grocery shop, food bank, pharmacies, that type of thing. But we're also really working on how can we deliver things, deliver the essentials to people. So people can call one of the food banks and get it arranged for the grocery shopping and get it paid for. And we will be glad to pick it up for them and take it to their house and drop it off for them, all free of charge. The phone number that we're asking people to call during this time is on the screen there, the 735-5733 number. If someone doesn't answer, if you just leave a message and let us know, we'll be glad to get back with you and help you in any way that we can. Like Janice said, if you need something, just reach out. We will be glad to try to get the right solution for you. Go ahead and change slide for me.
Sorry.
That's okay. There we go. So here's some other options that are out there just in case people weren't aware of it. Vancouver Police is doing a prescription delivery, and I put their phone number and the webpage on there as well. It's a Monday through Friday thing, free of charge as well. Area Agency on Aging, another great resource. They're great partners with Janice. For this, I put the link in for what resources are out there. So it has what grocery store hours are done, who's doing different food bank, all sorts of just what's going different because of COVID to really try to help people out. And then I wanted to make sure I had Catholic Charities phone number and link out there. They're a great transportation program as well for low-income seniors typically, but they also do a lot of other things. The link specific for transportation, but reach out to them if you have any needs and they can certainly try to help as well. Next slide. And I just wanted to give a couple more links just, to take some of the stress off. Lyft and Uber can be really inexpensive transportation options for you out there. And I know a lot of people that we've been talking to that are looking for transportation help. One of the things they just really need is stuff taken off their plate. So I just wanted to say, Uber Eats, Grubhub, DoorDash, that type of thing, most of them are waiving their fees right now. They can ring, dinner to you and just take the stress off. Take one day that maybe you don't have to necessarily check in on your loved one physically. They can do that. And then just one more time, I wanted to put that our phone number and the Trip Resource Center reference to you. And then, yep, go ahead. Just wanted to say that, we will have all the presentations. Christine will have them out there on Loving Them Forward. I've got their link for you, her phone number as well. And then truly, if there's any transportation needs you have, reach out to us, 360-735-5733, and we will be glad to see what we can do to help you. Thanks.
Thank you, Jean Ann, very much. Really appreciate it. Now we have Bill Cohen with Cohen Caregiver Support. Bill, thank you.
Thank you, and thank you everybody for joining us today. I'm Bill Cohen. I'm a certified senior advisor with Cohen Caregiving Support. And you go to the next slide. Tell you a quick story. About 15 years ago, I was starting my own journey with my mother, Sheila. It was about a 10-year journey. And at that time, when I was looking for resources, they were even harder to find back then. You had to basically let your fingers do the walking and make a lot of phone calls, that type of thing. Things have changed a lot since then. And now, of course, during the current pandemic, it's even harder or very different. One of the first things I did was start attending a support group. And that's the main thrust of what I want to talk about today, because that's what I needed. It was resources, and whether it's the Alzheimer's Association or other resources, they can provide them. So let's go on to the next screen. Starting nationally, keep in mind the Alzheimer's Association, including all other forms of dementia, have a toll-free 24/7 line. You can call in the middle of the night, somebody will answer, somebody who's trained to handle your problem, give you advice, maybe tell you where the nearest support group is or education program. So that's a great number to see or to keep in mind. Again, all these resources will be available later on. Next screen. Another good one on the national level is the National Alliance on Mental Illness. Their website is there. They have some good resources there, including support groups and education. So you'll want to keep that in mind as well. Next. Also, especially for veterans, is the National Caregiver Support Line. You can see the number up there. Also, it looks like it's toll-free, and the website, so keep that in mind for resources and referrals. Next, please. A great resource, again, is the Alzheimer's Association. Of course, that's national, but we have our own chapter here in Oregon and Southwest Washington. What's listed here are some wonderful education programs, including Living with Alzheimer's, Legal and Financial Planning, the top 10 warning signs of Alzheimer's. These are all online right now. So you can go to the website or again, call the 800 number to register. I highly recommend them. Next, please. Another great resource is the Dementia Action Collaborative. You're not going to see everything here. There's a long list. It could be available on the Hope Dementia Support Groups page, but also, again, we'll provide that list afterwards today. But you can see there's things for support and tips and staying healthy, and these are all resources for family caregivers, especially during the outbreak. Next, please. So speaking of Hope Dementia Support Group, this is, if you're not familiar with them, and you should be, it's a nonprofit in Clark County and parts of the Portland area. They are weekly support groups. They have gone virtual. They've gone online to Zoom calls, like most things these days. You can see the phone number there and the website. I lead one myself every week. And again, I found very helpful. I found it informative, supportive. You know you're not alone. There's other people that are going through what you're going. So I highly recommend, if you're not participating in a support group now, please do. Next, please. Also, the Alzheimer's Association has monthly meetings, and you can see they are all over Southwest Washington and Oregon. The website is there, the list is there. You can register either through clicking on the link on to each location, or again by calling the 24/7 helpline. I facilitate one of those groups on that screen, Tiger, down in Southwest Portland. That's the same group I started attending 14 years ago. That's how important I feel that these groups are. So check them out. Next, please. It was alluded to by, I believe it was Janice earlier briefly. The senior wellness check, you can get free phone calls by setting up by calling the phone number or checking with the website. This is a great resource, or you can set up for calls are made at a prearranged time for those who are isolated. And remember, they're not just isolated like we all are, they are also scared and vulnerable. Next, please. So another support group is one that I've started through my Facebook group, which is named here. I'm doing them on the third Thursday evening every month. I plan to continue this even once we are eventually allowed to get together in person again. And so there's another option for you. So I'm leading 3 different groups. They're very valuable. Very quickly, I am a caregiving support consultant as well as a volunteer and a facilitator. Here's my phone number or my email. I support family caregivers by providing advice, resources, and referrals, and reduce your stress and save you time. So thank you for your time, and I hope you will check it out.
Thank you, Bill. We really appreciate you. Thank you. So Linda, you're next. Go ahead, Linda. And go ahead and get your video up here. All right, there we go.
I am.
Thank you, Linda. She's with Community Home Health and Hospice, and she'll be speaking about medical resources today.
Okay, go ahead to the next slide. And everyone, welcome and thank you for joining us this afternoon. I'm going to talk about some medical resources. You don't need to try to write down any of the numbers or anything because that'll be supplied to you later. Next. We're going to talk a little bit about medical services that are available. So hospitals and emergency departments, they are open. However, if you're dealing with someone and caring for, say, someone with a special need or immunocompromised situation, you don't want to just walk into the hospital emergency room. You definitely want to call first. And this is going to be true of clinics as well. Almost all the doctor's offices are open. Urgent care clinics are open. Zoom, I think, is not. They're just doing online right now. Ambulance services, of course, are open. They're always open. Some dentists and most chiropractors are open, but they're seeing patients on a very select basis. They're trying to limit maybe 1 or 2 people in their facilities at a time. Now, there's some outpatient services that are open specifically for physical therapy, and they're doing some online and even having some exercise groups, so anyone can join those. All the mental health facilities are currently open, usually call first. And of course, our fire department 911 medical emergency responses are open, and pharmacies. Okay, go ahead. Some of our support services that are available, durable medical equipment, most of those facilities are open. The caring closet, if you're familiar with them, they're closed right now. And they will supply DME walkers, bedside tables, things like that at no charge for everyone. And there'll be an announcement when they open up again. We've already discussed the food banks being open and the food pantries, Meals on Wheels, and a couple of the support groups that Bill discussed. Now, if you're needing a home health services, this is medical care in your home supplied by nurses and physical therapists, other therapists. The requirements through Medicare is that you must be homebound. That means you just can't comfortably be leaving the house except for doctor appointments. This service has to be referred from your doctor, your practitioner. We'll need to have insurance information. You have to be willing to have a clinician and a nurse come into your home, and you have the right to choose the type of agency that you want to use. For hospice services, we're all open. We're even seeing some COVID patients. Again, this requires a referral from your physician. We need medical insurance information, be able to have somebody come into your home, And again, you have the right to choose the agency. Next. Okay. There are private duty home care and nursing services available. Now, these people can come into private homes. They can also go into some of the facilities, assisted living facilities and adult family homes. But during this COVID situation, a lot of them are not allowing people to come in. So you have to check first. Most of them require an assessment, and that can sometimes be done on the phone. You have to, again, be willing to have this person come into your home. And then there's nurse delegation services. Most of those are open. Some are doing them by Zoom or MS Team meetings, and also be willing to have them come into your home. Some of the services that they can provide would be diabetic services if they need insulin injections, podiatry and foot care, especially for the diabetics, staff blood draws. If you don't want to go into a clinic to have your blood drawn, they can come to you, and then they can deliver that blood sample to the testing facility. Okay, next. Other support services that are open, the home placement services are open. They're usually doing virtual tours. So if you have someone that needs to go from their private residence and maybe to an assisted living facility or an adult family home, there's several available. You could just give them a call. I can also refer you to the Retirement Connection Guide. There, everything is listed in there. All of the facilities that are available, the housing placement services, everything you need. Hypnotherapy services are available, and they're doing a lot of online right now, especially for people with high anxiety, helping them through that. End-of-life doula services that Megan will address shortly. And guardians ad litem are also available. Just call for information. And besides the support groups that Bill discussed, these are some other ones that are available. They're all open. They're all available by phone. Give them a call if you need them. And here's some COVID-19 related services that are available. Peace Health Southwest Medical Center said that they do have some masks that are available. You just need to go and pick them up. I would call first to make sure they have some stock available. The same with the Greater Vancouver Chamber of Commerce. They can direct you to groups that are making masks, and so you can find something on your own. Now, the Legacy Hazeldale Clinic is doing a drive-up COVID-19 testing. You first have to have a virtual visit with a Legacy facility before you go. So don't just drive up and try to get a test. The Vancouver Clinic, they're offering pre-screening for their patients. So call them. They also have to do a virtual visit. And some of the COVID-19 updates, don't rely on Facebook to get your COVID information, even though we all know that everything on Facebook is true. These are some more reliable sources: the Center for Disease Control, the Clark County Public Health Department, Greater Vancouver Chamber of Commerce, and another one that's not listed here is the Washington Department of Health. They have the most up-to-date and comprehensive information. Okay, thank you all.
Wonderful, thank you, Linda. And we have Karen with Geneva Woods to give us a quick update on pharmacies and what the pharmacies are up to. Karen, if you'll go ahead and start your video, would love to have you on screen here. All right, here we go.
There we go.
Hey, Karen, how are you today?
Great. Good afternoon, everybody.
Good afternoon. Thanks for coming.
Yeah, thank you for the invitation. What a great bunch of information. I'm just very excited to get the deck and share with all of my colleagues. Just wanted to share a quick overview of an important pharmacy service we have. We have a Healthy at Home program, which essentially takes the place of if you get your medications in bottles, we would instead dispense those into multi-dose bubble packs so that all of your morning, noon, afternoon, and bedtime medications would be already set in the bubbles for you. We send those out at 28-day supply. We take all insurance except for Kaiser, VA, and the Providence Elder Place. There is no charge to be in the program. We do deliver direct to the residents, so there's no need for the individual that's participating to come to pharmacy to pick those up. Standard copays apply, so the same charge it would be to go to any other pharmacy. It's just it eliminates the need for an extra family member or friend to come to their loved one's home to do those pill minders for them. We have it all set up for them. And we can also do the routine and PRN medications through that same program.
Wonderful. Thank you, Karen. All right, looks like we are ready for Megan Hope with Bridges End of Life Services. Hey, Megan. Go for it.
Yes, so my name is Megan Hope and I am with Bridges End of Life Services and I am a certified end of life doula. You can go, please note on this one, the Bridges Northwest is correct. On the next page, I realize it's missing the S. So it is bridgesnw.com. Go ahead and, next one too. Okay, so at Bridges, we do provide end-of-life doula support. Right now, we are doing that via Zoom. Believe it or not, we can still do bedside vigils and things like that via Zoom. If somebody is in home, depending on each case, we sometimes can go in the home because we have PPE. And basically, we serve people at the end of life, both before, during, and after death support. There's also the Southwest Washington Death Cafe, and Death Cafe is part of a larger movement that was started in the UK back in 2013, and simply we talk about death in a small group, and that can obviously be an array of topics, and each Death Cafe is very different with a different topic kind of each time at each table. But now that it was via Zoom, we just had one on Sunday and it went absolutely wonderful, and we had about 13 or 14 participants, and it was a really great conversation. So we'll be updating that and probably doing some more via Zoom. There's also the It Takes a Village Facebook group, and that was simply put together for people that just need support at end of life. But things like COVID-19, we're definitely seeing more stories of people going into that group and needing help with all the resources that we're providing today. So obviously we'll put all these resources in that group also. Grief support, including anticipatory grief. Just because COVID-19 is here does not mean that people are not dying of other things, like, you know, life continues. So I want to first mention Heal Your Grief, Heal Your Life, which is Ann Allen, and she is an advanced grief recovery specialist. Her phone number and her website is, as you can see there. And right now it's individual grief support via Zoom. Plus she's doing a lot of other great things. I highly recommend getting on her email list right now. Agencies that provide group and individual grief support via video conferencing or over the phone. Call to find out more with each one. But we have Hope Bereavement Services through Peace Health Southwest Medical Center, Home Care, and Hospice. Like I said, make sure you call first to see how they're handling their grief support groups right now. And also we have, of course, Seasons of Hope Grief Center and Memorial Gardens. Hospice services and centers. So first of all, what is hospice? Hospice is medical care to help someone with a terminal illness live as well as possible for as long as possible, increasing the quality of life. So our local hospice organizations, Linda obviously went over this, but we have Community Home Health and Hospice. They also have a COVID-19 link that you can find out more directly about that right now. And in the hospice center, I did want to make note that if somebody is COVID positive, they can have a loved one with them at kind of what we call that last hour. And there is limited visitors in general at the actual care center. Then we have Peace Health Hospice, Southwest Medical. And so I have a link there. They also have information specifically regarding COVID-19. And also about Ray Hickey House, which is their hospice center. So again, you always want to call to get the latest information as to what their rules and regulations are right now. And then we have Northwest Kaiser Permanente Hospice and Palliative Care Services. And again, their information is there. And of course, don't worry about taking all of this down, as all of this information will be available. And I can see that people are also chiming in, because there's Villages, Clark County also, that's part of, that can also help out. So let's talk about advanced care planning and POLST. What is a POLST? Portable medical orders. POLST forms are medical orders that travel with the patient. Your state may call it something different than a POLST, but it's definitely important that you learn about that, and it's between you and your medical provider. Advanced planning or advanced care directives are a little bit different, because that's something that you can do on your own. Life Transitions End of Life Coalition of Southwest Washington does advanced care planning, and the Life Transitions End of Life Coalition uses the Honoring Choices Pacific Northwest program, if you'd like to learn more about that. You can also call Julie directly right now and make an appointment, because they can help you with your advanced directives and that planning via Zoom or over a phone call. And then there's just a little bit of information of what Life Transitions End of Life Coalition is. A group of individuals and organizations committed to providing education, support, resources, and information to the public, healthcare professionals, and community advocates about living and dying well in Clark County. Funeral, cremation, and burial services. As many people know, this has changed quite a bit, and it's very important that you call each place specifically. As you can see, this is a very short list. We have numerous places that serve Clark County, but basically funeral homes have currently changed the rules on how they're operating during COVID-19. Most are able to conduct some kind of service. Some are being done via Zoom. There's also some states and counties are allowing the 10 or less people for gatherings. Again, very important to call and get this information from the place directly. I have Evergreen Memorial Gardens listed, and I also have Vancouver Funeral Chapel, and they can give you a lot more information that you would need regarding information if you have a loved one that dies and you do not have those services prepared already. Next slide. And legal advice. A lot of people, it's on their mind right now. Maybe I should get my stuff in order, right? So I did want to definitely talk about the law office of Heather Norton, because she is mobile. And so that would be things like power of attorney, wills, trust, other legal services that you would need for end-of-life planning. And she is still offering these services during COVID-19 remotely via phone or video conferencing. Fun little story about that. She actually had to go to somebody's window to get some stuff signed. So we all of us in the end of life are making things work, so as much as we possibly can. And so definitely reach out to her if you would like to get some of these things in order, or especially need to right now. Next slide. This one was a little bit more difficult to find people that are doing this right now. So there's notaries like like UPS store, but what if you can't get there, or you shouldn't get out? So you might be immunocompromised. So the mobile notary that I found right now that is definitely still up and running is PDX Mobile Notary Services. You will notice that they are based out of Vancouver. So they are definitely serving Clark County. And I know they're taking extra precautions to go ahead and still do their notary services for everybody. I do know there's other traveling notaries, but make sure that you call ahead to see if they can come to you. So yes, if you have questions about any of this, obviously this is a very short list, and I'm actually putting a PDF together that I'll continue building on, and that will be available if you want to call me directly at Bridges End of Life Services. My phone number is up there. Plus you can call Loving Them Forward, and you can also always refer to the Loving Them Forward Facebook page. Thank you.
Thank you very much. We really appreciate you, Megan. Really, really appreciate you. All right. Okay. Well, so before we end our presentation together, I wanted to just ask our audience, our attendees, our participants today, whether you're on Facebook Live or whether you are in Zoom with us, if there's anything else that we have forgotten today that is open, that is ready for service, that people can access right now, please go ahead and put that in the chat, or you're welcome to raise your hand, and I will try to see if we can add that. So we do have Heidi Marshall did note, she chatted in there with her phone number. She is another traveling notary that is operating right now. She's not afraid to operate. She's ready to come to homes to help people out. So she's there in the chat. We also have John with, looks like John is with North Villages, Clark County. And it says there's a lot of the donation centers have closed down. And so if someone has passed away and the items need to leave, this is becoming a real challenge. So if you do know of any resources that can help people who need to move all their stuff out of a house, out of an apartment, people are really having problems with that. He happens to have somebody right now who needs things out by Friday. So if you do have any information for John, his email address is in the chat. Looks like Adult Care Pro mentions that they are open for business and have not stopped helping people find adult family homes and assisted living and memory care. We have John Van Beek notes that he's offering a form of socially distant life enrichment via video performances for seniors or anyone else interested. So John, please do put in your link in the chat so Debbie will have that as she compiles her resources after this call. Is there anybody else who has a resource that we all should know about to compile in our notes? Great music, we remember. Thank you, John. Appreciate you speaking up. Let's see, Janice. Go ahead, Janice.
Hey, Benjamin, just wanted to make a note that the diner, yes, they are open, but they did modify hours. So we're only open Wednesday through Sunday, but we are open from 9 to 4.
Beautiful. Thank you.
Thank you.
Got that, Debbie?
Versus on the food line, Perfect Dish. It does cost a little bit of money, but it is a local resource, and they're practicing all of the social distancing protocols, and so that's an option. And also another notary, traveling notary, is Susan Egloff. Susan E-G-L-O-F-F. She's been to quite a few of our SSN meetings, and that's a good resource too.
Wonderful. And what was, you say Perfect Dish is the restaurant you were talking about?
Perfect Dish.
Okay, beautiful.
Yeah, they have a lot of different options. They have vegan, they have gluten-free. It is a little more spendy, but for those folks that just want a little bit of different taste, and if they can afford it, you know, little variation from Meals on Wheels, which I love Meals on Wheels, but it's just another variation.
Beautiful. I see John Warner also mentioned that Oasis Senior Advisors is still open for business and helping seniors find the right place to live, especially if they're being discharged from a hospital or a nursing home. Janice, you have a question from Heidi Marshall. Is the diner for pickup only? Is that correct?
So I did type back, it is for pickup only, but I have to tell you, if you wanted to do an order and wanted to have it delivered, I'm sure we have somebody available to do that. I do have a couple staff members there that are twiddling their thumbs trying to figure out stuff to do. And if it's within 10 miles, I'm sure they'd bring it to you.
Beautiful, thank you. Let's see. Tara, thank you. You will email Debbie. Debbie, could you chat your email address right into the chat line? Tara has a resource that she wants to share with some free legal services, but just doesn't know, and she'll find out and email that free legal services to you, Debbie. And then
right now.
Jen, you mentioned that if you're struggling with loved ones not protecting who you are caring for, I recommend calling the court system. She has a link below for filling in for the court system, extremely helpful, free to file. So she has a link there in the chat for how to deal with really dangerous situations where a vulnerable adult needs some protection. Thank you, Jen. Really appreciate that. Okay, does anybody else have a resource before we let Christina end our time together? Anyone else? Simply Time Catering. Debbie Russell mentioned Simply Time Catering is doing a lot of delivery and has a great extensive menu for folks. Did I hear one of you on the call have something to say?
I was going to say, does anyone have resources for or need resources for mental health?
Oh, that's a good one.
Because there's Rainier Springs in Vancouver, and there's another 800 number. I think I gave it to Linda. You know, we're all kind of stressed right now and feeling anxiety, and, you know, anyone having suicidal thoughts or otherwise, you know, we can provide those resources as well.
Great. Well, thank you. So let me share the last few slides with you as Christina takes us away here. Give me a second. Well, first I should definitely thank our sponsors. Our sponsors are, hold on here, having a little problem here, 1 second. There we go.
Thank you, Benjamin, for doing this for us.
Thank you all. Thank you. I did hard work. Really appreciate that. Well, whatever the problem, I'm having a problem with my computer. Can you see, Debbie, can you see the slide or not?
Yeah, I can.
Okay. So thank you to the presenters today, Human Services Council, Bridges End of Life Services, Kelsey Communities, Geneva Woods, Meals on Wheels, Cohen Caregiving Support Consultants, Community Home Health and Hospice. Did I forget somebody? I don't think so. All right, my friend Christina, please send us off with some good remarks and tell people how they can get some more information.
All right. First of all, I want to thank everybody who joined us today. Really appreciate you guys being here. Hope that you can use this information, but you can also pass this information on. I know that there are a lot of people out there looking for resources. We heard some of that in the chat today. We are going to be posting these slides and also any additional information on our Facebook page. You can also see it on our LinkedIn page as well. So if you want to go to our Facebook page, Instagram, LinkedIn, make sure to like and follow Loving Them Forward, because as we mentioned before, Loving Them Forward is not just myself, it's a whole community of businesses, organizations, and individuals that are amazing and here to help all of you. So thank you so much for participating today. And if you need anything, feel free to reach out to Loving Them Forward, either on our Facebook page, or you can call our caregiver hotline at 360-524-4344, or on our website or our email. Thanks so much, you guys, for being here today. And make sure that you're reaching out to any caregivers that you know and letting them know that they are not alone. We're all here for you guys.
Thank you all. Have a great week and reach out with questions.
Thank you.
Thank you.